Welcome back to the show. Throughout the COVID-19 pandemic, people experiencing homelessness have faced a unique set of challenges in protecting themselves and their families from the virus. Now, those individuals experiencing homelessness are already at a higher risk for COVID-19 due to underlying health risks and other factors, while homelessness itself creates barriers to meeting social distancing guidelines, as well as accessing testing, as well as treatment. According to a recent report, the number of single adults sleeping in cities' Department of Homeless Services shelters have reached more than 20,000. Now, despite efforts made by the city to address homelessness, it still continues to be a major problem. Joining us now to share a little bit more about the details on the matter, I'm joined by the program director of Family Homeless Shelter and also the founder of I Am She, Dr. Xellex Rivera. And Dr. Rivera, good to have you here.
Great to be here. How are you?
I'm doing good and glad to have you here on the Social Justice Forums. I want to talk a little bit about this because for many people, I don't think that we have a full grasp of the magnitude of really how homelessness is really gripping New York City, particularly after COVID-19. So can you just walk us through a little bit about where we are in regards to homelessness in COVID-19?
So homelessness is shifting slightly. When the pandemic had initially hit, it was kind of up and kind of down, kind of up, kind of down. I think on the family side, more families were staying home with their family members. They weren't actually entering shelter, maybe the same way as it might be happening on the single side. But now we're starting to notice with housing regulations going back into effect and, having to pay up rent and cost, things like that they are returning to shelter now in larger amounts and droves. I think that is being seen more on the single side of shelter than it is currently on the family side. Working on the family side, I work with families with children under 18, and we're still seeing a kind of weird intake process. We have enough vacancies, at least within the agency that I work for, that we're still trying to bring up to try to get filled. But then on the single side, there are more single people going into shelter.
Right. So on the family side, you're doing pretty good. Single side needs some improvement. Talk to me about the family side for a minute. Are there any interesting dynamics that you can give us with regards to what we're seeing?
Well, the difference on the family side is that, they have individual units, which is different than the single side, who are mostly sleeping in dormitory style facilities. On the family side, you have your own unit. So that kind of helps with COVID because you're able to quarantine or stay within your unit. You have your own cooking amenities, so you don't have to come out of your unit. So it was just easier to monitor the spread of COVID, I guess, for the most part, on the family side. There actually has just been a slight spike in it now because we're kind of shifting, like in New York City. So you're still able to go outside. Stuff is actually opening. You might be exposed more to COVID, which is impacting the shelter system, but it's just easier for us on the family side. Now, on the single side, you're talking about, dormitories of 50 to 100 plus men or females that are sleeping all in open space, and they don't have cooking amenities. So therefore they have to, eat lunch together, eat dinner together, which makes it a little harder to slow down the spread or stop the spread of COVID within the shelter system.
Yeah. Before I got to you and interviewed here, I was in a meeting just a few minutes ago. We are talking about vaccination and the issue of the homeless came up, talking about how the homeless should be vaccinated. Are they getting vaccinated? And the need possibly for them to partake in the Johnson & Johnson vaccine because they are a transient community. What can you tell us about vaccinations and that rollout for the homeless?
So it's definitely being promoted for staff for the most part, because staff are the persons who are frequently going in and out of the shelter, opposed to those persons living in shelter who can actually stay put in shelter. I know, again, for the agency that I work for, that they are advocates for the vaccine. They're trying to equip us to, or have resources for us to get the vaccine, whether that's Johnson & Johnson, Moderna, or Pfizer. Because even though we're not frontline workers, we are essential workers and we're still exposed to or have high risk of being exposed to COVID as well. As it relates to the clients, again, a lot of clients are not, they're not excited to see doctors even before COVID. Now we're talking about a shot, and there's a lot of historical characteristics to that why a lot of our families are not looking to get vaccinated. that we're still trying to get consumer buy-in, I guess, for the most part, to try to get families to do it. But on the single side, I do know that there are some shelters in New York City that are working with not only their agency, but the Department of Homeless Services to try to put hub locations at the shelter. They also have more spacing available than most family shelters, to have the spacing available to have a vaccination hub to where it's more available and the resources are there for both staff and the clients.
Yeah. So when we talk about families and the receptivity, you're saying that some really still have that hesitancy that we're talking
Yes.
about?
Yes, it's a lot of hesitancy. For the most part, a large portion of the families or people in shelter in New York City are minorities, African American, Brown, Black families. So we're talking about cultural differences or cultural understandings from our history that we're not too excited about shots and history and medical components. So we're not very eager for it. Let's say it like that. There are other questions that spike up, especially in young adults, and a lot of the families have young adults that, it's talking about fertility, and they're worried about the research around if they can get pregnant again, how that will impact their bodies, how it would impact their children. All of these questions are coming up. And while research continues to grow and evolve, we're not 100% with a confident answer yet. So that is delaying, I think, some of the buy-in. Not to mention, is not very accessible. You can't just always pop into a Walgreens by you, depending on where the shelter is, or pop into wherever the resource is for the vaccine. So I think one of the main hiccups is that it's not readily accessible in neighborhoods for us to be able to get it. And a lot of them are not eligible. We're talking about, again, populations under 50 that might be in family shelters at least.
And so, as we're talking about risk, right? If they're not getting vaccinated, you're going into shelters, staff members are going into shelters. And the question is like feeling safe. How safe do staff feel when you know that there's this hesitancy and the slow moving when you have that population saying, you know what, I think I'll wait, to go into work every day?
Well, I think the Department of Homeless Services was really good at being supportive to agencies in New York City, where we were able to put certain precautions into place. Like when COVID hit, they allowed us to go into virtual settings so that we're now able to meet our clients virtually, that we did not always have to see them the way we did before, where we had to see them weekly or biweekly. So now our weekly and biweekly sessions were being held, via Zoom or, Google Meet, whatever app we can use. That was very helpful. Unit inspections became virtual. So we were able to convert our services or our delivery of services to a remote virtual setting, which was great because clients now want to tell you more, that they don't have to come meet with you. So now you are able to text them and call them and see them. Now, as far as the safety concerns, a lot of stuff was put into place. Plexiglass was put up, masks, gloves, gowns when you have to pack up people's belongings. Masks are given out weekly. Everybody has PPE. Everybody has hand sanitizer. And certain procedures were put in place at shelters, like temperature checks, which make you just feel more comfortable when you're entering a shelter overall, as well as cleaning on the hour. So those, even though a lot of people might say that those are small things that were happening, it does make you feel better that when you walk in there, you're smelling Lysol, you can see them cleaning, you have your mask on, they're staying 6 feet away. All of those kind of things make it a little better for you to go into the shelter and service your clients.
Yeah, we've been at it for about a year now, right? And so as we're at it for a year, recap the year. What's it been like for you?
Oh man, the year was really unique. When the year first, with last year, when it first kicked off, I was prepared to sleep in the shelter with my clients. That's just because I've been in shelter a long time. I know crisis management, no matter if it was a hurricane or COVID, So I was prepared to sleep in the shelter, be with them and the clients, and we all had to quarantine, things of that nature. It was really good that we didn't have to go that far. Again, the agency I work for, that they were very proactive in not just incentivizing the staff, but they wanted to make sure the staff was comfortable, pandemic pay, cleaning, things of that nature. So in the beginning, it was easy on the family side because they complied, right? Because they have kids. I think on that side, once the city shut down, they was in their units. Once it started being months and months and months of quarantine, that's when you start to get the attitudes and anxiety. And now the depression has spiked. And now, they don't want to be in a unit with their kids anymore. Some parents are not equipped to do remote learning with their children, and it's very challenging. You can have the brightest kid and, learning online is just not conducive. So all of those things started to hit later on around, let's say like the 6 or 7 month mark, which then took us in a peak because now people are panicking. You had to create more interventions to try to help, single parents with their kid in that little unit trying to do remote learning. So then it became creative, I guess, on my side as a worker. And then once the city started opening back up, you had to constantly remind the families like COVID still exists. And you still have to do that because now they can still go to a restaurant and come back to your shelter, or they can be exposed. The other thing is that there was an increase of persons from out of state that was coming into New York. So while some reports indicated that a lot of New Yorkers were leaving New York, there was also a good portion of people from other states that were entering New York, coming into our shelter systems from Florida and all of these higher spike places. And then that was creating more tension and risk within the shelter than before. So it was almost like an up and down roller coaster for the whole 2020. Now people are much calmer. They are complying way better. Everybody has on a mask. Everybody's wearing, gloves that they feel that's more safe. And then they're moving forward a little differently.
Usually when it comes to talk about the homeless, there's a certain demographic that you look to. But the reality is for this population right here in New York and the homeless population, there is a large millennial homeless population. Share with us about millennials and homelessness.
So millennials are a very unique generation. My research touches on how millennials are considered the narcissistic selfie generation, but yet we're the highest degree generation to date, graduates to date. However, we're not following society norms, which then could put us at higher risk of entering shelter, right? So we want to stay in our mother's house longer. We want to stay with our parents longer, or whoever's our caretaker longer. And then eventually we get put out, or maybe we don't get put out. But outside of that, we also seek shelter for more resources and things of that nature. But it's actually bigger on the family side, even before COVID, that you would see a lot of single mothers or single mothers or couples, young adult couples, millennial couples that now have children and now they want to seek their independence, and then they're seeking their independence by entering shelter. The other thing about the generation is that they are delaying adulthood. They basically don't want to be adults. So they're doing everything in their power not to pay bills and not to do what our normal society would do. So that is also increasing their risk of entering shelter because now they can have another safety net when coming in to get services. So especially on the family side, like I said, there's a lot of single mothers, or single fathers as well, believe it or not. There's a lot of single fathers and they're all young adult age or millennial age.
Wow. I want to ask this question here. When we think about what's going on right now, we know that the governor has had some moratoriums when it comes to rent payment. A lot of people, New Yorkers, are taking full advantage of not paying rent. But we understand the moratorium is going to be over soon. People are going to be coming out and going to court because of evictions. Any concern on your end with after the governor's moratorium lifts and what we see across New York City that you may actually be facing a big increase of people coming through your doors?
Oh yeah, it'll be a huge increase.
She said huge, okay.
A huge increase. And if we're just gonna focus on the millennial generation that might have spent their money traveling, we're talking about Generation Z that does not even believe COVID exists. They've just been living their best life, as they like to say all this time, that might not have been paying rent or paying bills or whatever. So we might see a very increase, it'll be a big surge in families or singles in particular that enter shelter once this safety net is lifted. A lot of people right now, they're still saying, they have that grace period that the governor has given. Once it's lifted, they're not prepared. However, New York City does have home-based services throughout the city, which I'm pretty sure will do their best to try to prevent homelessness for some people. However, other people who have been abusing the system, unfortunately, will end up in shelter more than likely.
Wow. And so as we look to that, I mean, is the city prepared to be able to deal with that? Are shelters actually able to be able to sustain this influx of people that could potentially come?
I do think the city is prepared for it. This is a cycle that you can kind of predict, right? I can't really guarantee that there'll be a surge. I just know from my experience in homeless shelter and homelessness that there will be a surge, right? Because a lot of people have not been complying with the governor's grace period or utilizing it at a mature level, okay? But most of the shelters in New York City are prepared. There's over 100 plus shelters in New York City. And a lot of times I can say on the family side, the vacancy numbers might be low. And when I say vacancies, meaning there are open vacancies right now for families if they need services. So it's not as if, you know, a large population of our shelters are full, right? So on that side, we're preparing. Now, the single side might be a bit different, but the single side has different regulations where they have to be able to provide a sleeping space, which is much different than families where I have to provide you a unit space for you and your children. So the regulations can be different on both sides of both divisions, but yes, they will definitely be increasing.
Yeah. And with that increase, I know there's another population that we need to talk about, which is those who are affected by mental health. Talk to me about mental health and homelessness. And to the average person, what don't we know?
So mental health just hit everybody at the same time. And that's what people have to understand. We all experienced a spike in our mental health and our cognitive function. And that's kind of what COVID did, right? And when I say that, I'm not saying that we all are mentally ill. That's not what I'm saying. What I'm saying is when we went into a state of crisis, when we went into a state of lockdown, when we went into a state of remote learning, this impacted everybody from the governor down, right? So we're talking about high levels of anxiety, high levels of depression, high levels of inability to function, high levels of irritability, which was across the board. The problem is that I think that it is spiking, and I have not done research in this, but there is a spike in some persons that it might have gotten worse because of the unknown, right? You didn't know if you can go outside. You didn't know if you were safe. You didn't know this, you didn't know that. I think it has increased some levels of mental health or cognitive functioning. In addition to that, it has created other things such as learning delays in some of our children and adults, right? Because we were unable to help our kids effectively through that year, which caused more anxiety. So it's almost like this trickle down effect or this universal effect on our mental health as New Yorkers has increased across the board. Now, when the world eventually goes back to semi-normal to what we knew pre-COVID, it might help some persons, but a lot of people have experienced, and I can speak for myself as well, as it relates to creating those boundaries, working from home, being tired of working from home, wanting to go outside and socialize. You know, humans are designed to socialize and be around other people. So for us to have lost that now for at least the last 14 months has created different levels of mental health. But the population in the shelter, they're getting the same services, if not more at this point, that are equipping them. Again, that's another division of our city that has gone virtual. So all that teledoc and virtual doc apps that are out right now, they are able to still hear their therapist, speak to their therapist, and deal with all of these mental health concerns that they've been having via their devices. And for those persons who don't have devices, majority of the shelter providers have provided like house devices or additional devices for people to still have that access to those resources.
Give me a little bit about yourself, because I know that you've done some great work in the field of mental, well, not mental health, but also, well, I guess talking about a little bit about homelessness as well. And I know that's part of your research. Talk to us about your research. And before we do get out of here, make sure to talk to us about I Am She.
Yeah, my research was just focused on millennials in homeless shelters and on the single side, actually, not on the family side. You know, I was really curious and interested in understanding why we were seeking shelter at such high levels. If we were supposed to be the most degreed, the smartest generation, you know, the most tech savvy, adaptable generation, why do we need to not only seek shelter, but stay longer than the expected time? So my research has been great. I'm hopeful that I'm able to do more research over time to try to expound on homelessness in New York City as a whole, as it is my passion. But outside of that, the advancement of minority women and girls is also something that I strive to motivate them in New York City. So I Am She is a not-for-profit that focuses on that advancement. And the reason for I Am She is that I've always thought about, as I've gone up in my career, whenever I've hit a ceiling glass effect, and it's unfortunate that women still have to, battle ceiling glasses. However, it's always been a minority woman. So I wanted to create a conference or an avenue where these women can come together and realize that we're not competition, but we're actually sisters. So that's where the I Am She concept comes from. But when you pair those two together, like homelessness and I Am She, I just want people to think better for themselves, be more self-aware, and be better for the world.
Yeah. And when we look at women in the workplace right now, how would you break it down? I think we're seeing more become CEOs. I was just having a conversation with a few people just a few minutes ago.
Yeah.
In the world of sports, more people are becoming owners and having a high place. Are you confident with what you're saying?
Yeah, it's been kind of amazing and motivating to see, especially with having an African American or Black vice president currently. It is motivating for generations that aren't even born yet, and that's how we have to look at it, right? But again, like I said, it's sad that the ceiling glass even has to impact, of course, that we have to shatter it. We're still fighting for the, a dollar on a dollar kind of concept as it relates to equal income. However, I do appreciate or admire the fact that we are continuing to fight for those and advocate for ourselves, but not to be seen as a competition. And we have to be mindful of that, right? Mm-hmm. There can be a Black woman at the table, or a brown woman at the table, and there can be a Black man at the table or a brown man at the table. So we don't need to be confused and think that, the more that women elevate, that men decrease. They don't, right? We need to be able to help each other build up these corporate ladders together and just, be more successful as a whole.
Yeah. What do you have coming up by way of events for I Am She?
So I Am She's annual conference is on May 15th. It's going to be at the Radisson Hotel in New Rochelle. We're really excited. The advertisement will go out April 1st. Everybody can log into yesimshe.com for all of that information, or if they want to get apparel to just kind of support us. But again, it's May 15th at the Radisson Hotel in New Rochelle, New York.
Yeah. And when you look at Sheroes and those people that inspire you, who are they?
I have a few, believe it or not. I don't know if I really have like celebrity ones outside of like Michelle Obama, right? But I have more local ones, like Dr. Brenda Smith. She's one of my big Sheroes that kept me going. I had a mentor through undergrad that made sure that I had more substance than beauty. Dr. Proctor, she was amazing then. And then, my dissertation chair, she's in Canada. But Dr. Benoliel, she's been really amazing as well, and making sure that, I make sound decisions that not just impact me, but impact, my career and the people around me. So those are my top 3 Sheroes, as well as my mama. Y'all know my mama. I'm like, my mama.
Gotta give mom a shout out.
Gotta shout out mama, right? She went through a lot. She was a single mother as well. So shout out to Reverend Denise L. Davenport, who helped me navigate life and be as successful as I am today.
What do you still find to be the biggest challenge for women today?
We underestimate ourselves and we lowball ourselves, in all honesty. We typically don't negotiate across the board. Like, so if we go for a job, we will look at a job description, and if there's 20 bullets, we need to get all 20 bullets before we feel like we can do the job, instead of understanding that we have the top 5 bullets and therefore we can learn the other 15. So, we have to start thinking that way and push ourselves higher. And then when we start talking about negotiating of salary and what we are worth, you should be okay with pushing back on a salary to try to negotiate with an agency. I think those are the 2 biggest challenges, that we don't advocate for ourselves and then we don't negotiate for ourselves when we get into the work world.
Yeah, and gender equality when it comes to pay. I mean, equal pay is a struggle, and I think it's getting better with the hiring of CEOs and the way that we're seeing CEO compensation. But if we take a look at the NCAA, and you take a look at what's going on with women's basketball, and you see basketball, and you see the men's locker room, you see the women's locker room, you see the men's weight room, you see the women's weight room, we still got a lot of work to do.
Yeah, absolutely. Again, it goes into, motivating, our young girls. TV is not motivating us. TV depicts us in a way that, we should be focused on, changing our body, doing something like that, instead of focusing on going to school. But on the flip side of that, African-American women are the most degreed population in the US, if I'm not mistaken. But still, we go into corporate America, and if they offer us $1, but we know that Johnny made $5, we're not even going to ask for 3. We're just going to go with the $1. So we need to start asking for the same $5 that Johnny's asking for, because we're just as qualified, if not more.
Yeah. Dr. Xellex Rivera, we're going to leave it there, but thank you so much for joining us here on the Social Justice Forums.
Great being here.
All righty.